Welcome to Professor SNAB, where we aim to make A-level biology as simple as a cell. So today we are looking at knowing the benefits and risks of treatments for cardiovascular disease, and these include antihypertensives, statins, anticoagulants, and platelet inhibitors. The types of medication we have for treatments of CVD are antihypertensives, statins, anticoagulants, and platelet inhibitors. And these are the four you need to know for A-level biology. So what are antihypertensives? So these lower the blood pressure and works best for people who have hypertension, which is high blood pressure. So if a patient is under the risk of CVD, where it's a result of high blood pressure, this is the medication that's often prescribed. So lowering blood pressure reduces the risk of arterial endothelial damage and hence less likely to develop atheromas and thrombosis. And as we know from a previous video, the development of atheromas, which leads to atherosclerosis, is what usually leads to the development of CVD. So if you want a much more detailed video on that, it's uploaded, so you can always go back and watch that. So now focusing back on the drugs for the treatment of CVD. So examples of hypertensives are beta blockers, vasodilators, and diuretics. So beta blockers prevent increase in heart rate. And why is this beneficial for the treatment of CVD? It's because, as we know, increase in heart rate increases the chances of the endothelial walls being damaged, which then leads to the cascade of events that lead to the development of atherosclerosis due to the development of atheromas forming. So by having a lower heart rate, the risk of high heart rate being the cause for endothelial damage is much lower. Vasodilators increase the diameter of the blood pressure, which means the pressure is a lot more lower, as in the pressure the blood is pumped out in. And this once again decreases the chances of the endothelial walls being damaged. And at the end of the day, that is what all these drugs are doing. They want to reduce the chance of the endothelial walls being damaged so that further atheromas are not triggered to form. So diuretics reduce blood volume by lowering the amount of sodium reabsorbed into the blood by the kidneys, which decreases the volume of water reabsorbed into the blood. So once again, this reduces the pressure, reducing blood pressure decreases the chance of further atheromas forming, and that reduces the chance of developing heart attack, as in helps maintain the levels of CVD. So ACE inhibitors. So this is a type of a vasodilator, which is, if you go back to the previous slide, it's a type of antihypertensive. So it blocks the production of angiotensin, a hormone that causes the constriction of blood vessels. So as we know, constriction of blood vessels is what leads to higher blood pressure. So this drug basically prevents that. So this keeps the arteries dilated and this reduces blood pressure. So now we're moving on to the next drug, which is statins. Statins is probably something you've come across in GCSE biology before. So these drugs focus on lowering blood cholesterol. So this one, statins, they're focusing on the blood cholesterol, while if you look at antihypertensives, they're focusing on the blood pressure. So these drugs, statins, focus on lowering blood cholesterol by blocking an enzyme in the liver that is needed to make cholesterol. So if you look at a much older video on HDLs and LDLs, we know that high amount of LDLs in the blood can increase the risk of developing cholesterol, which means you're at a higher risk of developing CVD, and that is not good for you because you're more likely to have a heart attack. So That's what statins do. They lower the concentration of LDL in the blood, and that reduces the risk of atheroma forming again. So statins also reduce inflammation in the arterial lining, which lowers the risk of atherosclerosis. Once again, going back to atheromas. So all these drugs, like I said before, is focusing on reducing the risk of developing atheroma, because atheroma is what leads to atherosclerosis, and that is what then leads to CVD, and we want to prevent that. So now the third type of drugs that we want to look at is anticoagulants. So these drugs reduce blood clotting. So these drugs are focusing on the blood clotting aspect. So for example, warfarin is an anticoagulant that decreases the level of prothrombin in the bloodstream. Have we come across prothrombin before? Yes, we have. It's in a video about blood clotting. If you guys don't remember, please go back and watch that, because it's a very, very, very important topic. And less blood clots then decrease the likelihood of thrombosis, and that reduces the risk of blood vessels being blocked by blood clots. So that is anticoagulants for you. And now the fourth type of drug, which is platelet inhibitors. So these reduce blood clotting. Once again, just like the one we looked at just before, these reduce blood clotting as well. And in fact, they are a type of anticoagulant. So platelet inhibitors and anticoagulants, it's the same thing. Platelet inhibitors come under the category of anticoagulants, basically. So examples are aspirin and clopidogrel. You need to know these two examples because these could come up as a one marker. So yeah, keep an eye out for these two. And what does platelet inhibitors do? Just like the name tells you, it prevents the clumping together of platelets. So it prevents the formation of blood clots. So once again, if you guys don't remember what blood clots are, then go on to the previous video I made, a much older video I made actually on blood clotting, because it's a very, very important topic. I will say this a billion times. It's a very important topic, comes on so many past paper questions. So go back to it if you're not too sure on the topic. So now, antihypertensives, the pros and cons. So what are the pros of antihypertensives? So these are the ones that focus on high blood pressure. So, well, the pros are it reduces blood pressure, and blood pressure can be monitored at home and can be combined with other drugs to maximize effect. So it's something you can implement into your life much easily. So the cons, the side effects include headaches, drowsiness, heart palpitations, swelling of feet and ankles, and persistent cough. Patients could stop taking them because of the unpleasant side effects. So now looking at the pros and cons of statins. So statins reduce the levels of bad LDL cholesterol in the blood, hence reduces the risk of atheroma developing, and increased levels of HDLs, which are involved in the removal of LDL. So this just focuses on getting rid of the low density lipoproteins, because that is what leads to the development of cholesterol, which in turn leads to the development of atheromas. So what are the cons? It takes time to see improvement, so it's much slower and needs to be taken for a long time. So it's a long-term medication. So side effects include muscle and joint pain, liver damage, and neurological issues, and it can encourage an unhealthy lifestyle. So now, what are the pros and cons of anticoagulants? Pros, it reduces the formation of new blood clots, and that can reduce the size and growth of existing blood clots. So what are the cons? Well, unfortunately, the side effects include excessive bleeding because, well, the main function of blood clots is to prevent bleeding, right? So if there's a reduction in the growth of existing blood clots and reduction in the formation of new blood clots, it means you're going to bleed more in case of an injury. And in terms of injury, this applies to both external and internal. So other side effects, fainting, osteoporosis, and swelling of tissue, and damage to fetus is also possible. So osteoporosis is to do with weaker bones. So this is a condition you develop in much older ages. But yeah, anticoagulants could lead to the development of osteoporosis as well. So what are the pros of platelet inhibitors? So look out for this one because this, as we explored before, it's a type of an anticoagulant, so it's going to be very similar. So pros: reduces the formation of new blood clots, hence reduced risk of blood vessel blockage. And what are the cons? The side effects include excessive bleeding in case of injury, just like we saw the one before, anticoagulants, rashes, liver dysfunction, and stomach lining damage. And combination of multiple platelet inhibitors can increase the risk of the side effects. So once again, it has its own side effects alongside the benefits it brings. So yeah, that is all from Professor Snap today. Hope you found this topic useful, and this part of the chapter is quite interesting, and but it's quite a lot to remember, like quite a lot of pros and cons to remember. But hope this video has simplified that. If you have any questions, let me know in the comments below, or if you need further clarification as well on this topic or any topic we've done so far, let me know in the comments and I'm happy to come back to them. And feel free to share this video and don't forget to like and subscribe. Thank you.